Understanding the opioid epidemic. Opioids are drugs that affect the neurons in the brain and produce an excess of dopamine, which causes a euphoric sensation. Some of the common opioids include oxycodone, hydrocodone, morphine, and methadone. Heroin has a similar effect, which is why many addicts turn to heroin after they're addicted to a prescription opioid. The percentage of opioid deaths has increased drastically, and they are continuing to increase. Many families lose loved ones to opioid addiction each year. Most people who become addicted to opioids in the first place have been prescribed an opioid for pain relief in the past. This slight usage rapidly and easily turns into addiction. Loved ones become addicted very quickly, and some turn to cheaper, more dangerous alternatives, such as heroin. Many families are devastatingly affected by opioid addiction. For example, a child in the documentary stated that her opioid-addicted father killed her mother when she was only 5 years old. In 1996, Purdue Pharma produced OxyContin and created a marketing campaign that aimed to gain the trust of worried consumers. Because this video falsely ensures that less than 1% of patients become addicted to opioids, doctors began prescribing opioids to people experiencing pain above a 5 on the pain level. This false advertisement from pharmaceutical companies caused doctors to heavily overprescribe opioids as pain medication for all types of pain, from sprained ankles to wisdom teeth removal to brain surgery. There aren't many requirements in order to prescribe opioids as painkillers. One solution to the rapidly spreading opioid epidemic would be a push to increase clinical trials on alternative forms of therapy, such as acupuncture, physical therapy, exercise, yoga, and talk therapy. The reason for needing clinical trials is that insurance companies will not cover this treatment until there have been a number of valid clinical trials. Another helpful solution that works well for any issue is more education. Education about drugs and addiction will aid current and upcoming generations in fighting against the opioid epidemic. Teaching people how to manage addiction, how to avoid addiction, and what drugs cause addiction will lower death and addiction rates. Another solution to the opioid epidemic is fact-checking so that false advertisements like the one from Purdue Pharma cannot influence doctors or consumers. More attention needs to be paid to the prescribed dosage so that someone doesn't get prescribed too many. For example, a young man in the documentary was prescribed 185 pain pills for a 30-day period, and his parents weren't aware until his death. With the opioid epidemic still rapidly spreading and with little to no efforts to slow it, people will continue to become addicted and families will continue to lose loved ones.